Magandang araw sa inyong lahat and welcome to our 6th pre-recorded video lecture for the subject Clinical Practicum 101B. And this time, we will be talking about the genito-urinary changes during the postpartum period. I am your instructor, Dr. Jeffrey Reboron. So what are the physical changes that occur in the postpartum period? Number 1 is uterine involution. When we say involution, it is the process by which an organ goes back to its original size or shape. So when we say uterine involution, it is the process by which the uterus is transformed from pregnant to non-pregnant state. So since hindi na occupied yung uterus, there is no reason for it to remain stretched. So it will contract to return to its normal size and position. This period is characterized by the restoration of the ovarian function in order to prepare the body again for another pregnancy if the time comes. So always remember that a non-pregnant uterus weighs approximately 50 to 100 grams. And during pregnancy, the uterus, since it is occupied by the mother and since the lining of the uterus has to thicken for the placenta to properly implant itself in its muscles, it grew in size and weight about 10 times the non-pregnant weight. So kung kanina po, or noon yung non-pregnant uterus, I should say, is only 50 to 100 grams, nag-times 10 yung size and weight ng pregnant uterus. So this means that the pregnant uterus can reach up to 500 grams to 1 kilogram. But after the delivery of the newborn, the uterus will now involute to its normal size and shape, and it will return to its pre-pregnant state. So rapidly, it goes back to its original size and weight up until it reaches its normal size of 50 to 100 grams. So before the uterus can involute to its normal size and shape, there should be the presence of myometral or uterine contractions. In simple terms, these are called after pains. And these contractions are the ones which cause the involution of the uterus, or they cause the return of the uterus to its normal size. These contractions occur during the first 2 to 3 days of puerperium. Always remember that these uterine contractions will be more frequent and will become stronger if the patient is feeding her child. Why? Because during breastfeeding, there is a release of the hormone oxytocin, which is because of the stimulation of the nipples of the mother. And this oxytocin is from the anterior pituitary gland. And alam naman natin yung silbi ng oxytocin, it is used to stimulate the uterus to contract. So because of that contraction, the uterus will now involute to its normal size and shape gradually. During the first 12 hours of postpartum, the uterine contractions are usually regular, strong, and coordinated. So ibig sabihin, para din nagle-labor si mother ulit na meron din siyang regular patterns of strong, coordinated contraction. That's just on the first 12 hours after delivery of the baby. However, after the first day of postpartum, the intensity and the frequency, kung gaano siya kadalas or gaano siya kalakas, and the regularity of contractions will also decrease as the mother's body starts to involute. So since lumiliit na po yung uterus ng nanay, there is no more reason for the uterus to have a regular, strong, coordinated contraction. So as time passes by, nawawala din po yung myometral and uterine contractions. You have to remember that. Now, alam nyo ba na ang after pains are usually more uncomfortable for multiparous women rather compared to women who are primiparous. Bakit? Bakit mas malala yung after pains or yung sakit na nararamdaman ng mga multiparous women compared sa mga primiparous women? It is because the uterus of the multiparous women, since marami na silang anak, the uterus of the multiparous woman has already lost most of its contractility for being so stretched out masyado na kasi siyang na-stretch, and it would take a tremendous amount of effort on the part of the uterus of the mother to contract and to help it involute to its original pre-pregnant state. So always remember ha, mas masakit yung after pains na mafe-feel ng mga multiparous women compared to the women who are primiparous because their uterus is more stretched out. Alright. We also have the changes in size and position of the uterus. So, immediately, pagkapanganak po ng bata, the uterus weighs approximately 1 kilogram and is located at the level of the umbilicus. So, kung makikita nyo po dito sa drawing, during the first day of the postpartum period, the uterus is usually seen on this level, in the level of the umbilicus. Level tipuseg ni mother nga makita yu dejay fundus of the uterus. However, on the second up to the 7th day of postpartum, the height of the uterus will decrease by 1 centimeter every day until it becomes in level with the pelvic organs. Okay? And it will last up to the 12th day of postpartum. So, kung titignan nyo dito, sabi dito, every day, starting on the second day, magdi-decrease po yung height and position ng uterus by 1 centimeter. So, kung titignan natin dito sa first day, bumaba si uterus ng konti ng 1 centimeter. And when we compare the position of the uterus from the second day to the third day, bumaba ulit siya ng 1 centimeter. So, you have to remember that occurs on the second to the 7th day, and it may sometimes last up to 12 days of postpartum bago ma-reach ni uterus yung level ng symphysis pubis, or in Ilocano, batog tipos ong. So that is the change that we see in the size and the position of the uterus. However, at the end of the first week of postpartum, makikita na natin that normally, the uterus will become palpable at the symphysis pubis. So, 10th day, that is the most common or most normal na period kung saan yung uterus can be palpated on the symphysis pubis. But then again, as I told you a while ago, may mga pregnancies din na umaabot hanggang 12 days bago bumalik sa symphysis pubis yung level ng uterus. I hope that is clear. Now, what are the different midwifery responsibilities that we should do to assist the patient during her uterine involution? Number 1 is that in case you noticed any signs of abnormal uterine involution, kunwari yung pasyente hindi nagko-contract yung kanyang uterus, you should inform the obstetrician immediately so that infection and retained products of conception can be ruled out. Always remember that a relaxed uterus may be caused by, number 1, retained placenta, or number 2, it can also be caused by infection. So dapat, pag nakita mong relaxed po yung uterus, you report immediately to the doctor or to the attending physician so that the doctor can give either antibiotics or manual extraction or evacuation of placental fragments or dilatation and curettage. So, dapat i-inform natin si doctor para ma-rule out kung ano yung problema ng pasyente, bakit hindi nag-i-involute yung kanyang uterus. Next, if the patient complains of having persistent heavy bleeding, kunwari sinabi ng pasyente, sir, ang daming lumalabas na vaginal discharge sa akin, it should always be taken seriously. Hindi mo dapat siya sinasabing, normal lang yan, misis. Hindi. We should not do that. We always take the patient's complaints of persistent heavy bleeding seriously. So what do? Massage the fundus of the uterus to stimulate it to contract. Aside from that, you can also apply ice pack to stimulate the blood vessels to close by virtue of vasoconstriction. And we can also encourage breastfeeding kasi nga when we stimulate the nipple, mas lumalabas si oxytocin which will stimulate the uterus to contract. And after doing all those 3 things, report to the doctor immediately. wag mo pong papabayaan yung pasyente na magre-report ka muna bago mo gawin yung mga sinabi kong mga interventions. No, you should do the interventions first before reporting to the physician. Another midwifery responsibility that we have towards the primiparous mothers is letting them understand the concept of heavy bleeding. Sometimes, yung mga first time pa lang na magkaanak, they do not have any idea of how much blood loss is categorized as heavy bleeding. So, wala silang idea kung gaano karami yung dapat na dugo para makategorize natin siya na merong heavy bleeding. So what do? It is our responsibility as a midwife to help them quantify how much bleeding is lost. And paano natin gagawin yon? By weighing and documenting the soiled underpads of the patient. So sabihin natin, ma'am, yung mga underpads, wag munang itatapon, ikikilo ninyo yon. And then after weighing the soiled underpads, kung gaano karaming dugo, you subtract it by the weight of the underpads that is not soiled. So kunwari pag nakuha nyo na kilo ng soiled underpad is 750 grams kunwari yung soiled na underpads, and yung unsoiled naman or new underpad is 250 grams lang, makikita mo na yung bleeding ng pasyente is approximately 500 ml. So that's how you help them quantify the amount of blood that is lost. So aside from that, you can also note how much underpads are used after every 15 minutes. Kung yung pasyente po ay every 15 minutes na nag-change siya ng bagong diaper or bagong underpad, that is already considered a heavy bleeding. Therefore, what do? Massage the uterus, apply ice pack, stimulate the uterus to contract by allowing the child to breastfeed, and then report immediately to the doctor. So those are your midwifery responsibilities for primiparous patients. Now, what are the factors that affect the uterine involution? May mga pagkakataon kasi na hindi babalik sa normal agad-agad yung uterus ng patient natin in the 4th stage of labor. And there are many factors that affect this kind of phenomenon. So always remember that uterine involution may be delayed or prolonged due to, number 1 is stretched out uterus. Gaya ng sinabi natin kanina, for multiparous women, yung mga may anak ng 5, 6, 7, usually they experience difficulty when it comes to their uterus involuting. Bakit? Kasi sobrang na-stretch out na yung kanilang uterus. Or sometimes for patients with multiple fetuses, yung mga nanganak ng kambal, ng triplets, those have very stretched out uterus, and that will also affect the involution of the uterus. Aside from that, for patients with polyhydramnios, pag sinabi nating polyhydramnios, these are patients who have an increased amount or more than the normal amount of amniotic fluid. So, makikita natin dito, yung pasyente, malaki yung uterus niya na stretch out kasi sobrang dami ng amniotic fluid. So, those can also have prolonged involution. Aside from that, uterine involution can also be affected by maternal exhaustion. Kung sobrang pagod na po yung nanay, or kunwari nagkaroon siya ng dystocia or prolonged labor, you can also expect that the patient will also have prolonged uterine involution. So, nahihirapan siyang manganak. Basically, mahihirapan ding bumalik sa dati yung kanyang uterus. Aside from that, your uterine involution can also be affected by your full urinary bladder. So, kung punong-puno po yung urinary bladder ng pasyente, the uterus will not return to its normal position. Why? Because anatomically, the bladder is located in front of the uterus. So kung punong-puno po yung bladder, hindi po makakapag-adjust ng mabuti si uterus, hindi siya makakabalik sa dating position because the bladder is occupying a lot of space in the abdomen. Kasi nga po, punong-puno siya ng ihi. So always remember that a full urinary bladder will also impede uterine involution. Aside from that, we also have grand multiparity, which affects uterine involution. For multiparous women who have given birth for more than 3 children, they may experience delayed uterine involution, as discussed earlier. Aside from that, patients who have been given analgesia or pain relievers or yung mga nag-painless delivery or patients who were given anesthesia, okay, they may experience painless childbirth, but they will also have delayed onset of uterine involution. Bakit kaya? Always remember that pain or prostaglandin triggers contraction. So the more pain na nararamdaman ng nanay, the more din na magko-contract si uterus. Pero since si mother nabigyan siya ng painless, nag-undergo siya ng painless childbirth, so ibig sabihin manhid yung kanyang uterus. So kung manhid yung kanyang uterus, walang pain na nandun, walang magti-trigger for it to contract. So sometimes effects of analgesia and pain relievers can also prolong the uterine involution. Alam nyo ba na yung first hour after birth is the most dangerous time for a woman? Ito yung pinakadelikadong state after the delivery of the child on the first few hours. Why? Because if her uterus fails to contract or it becomes relaxed, nagkaroon ng uterine atony, there is a possibility that she will lose blood very rapidly. And majority of our patients die because of postpartum hemorrhage. So, it's good thing to keep in mind na pinaka-delikado yung first few hours after the delivery of the placenta. Kaya nga pag naging midwives na kayo, it is very important to check the vital signs of your patient every 15 minutes for the first hour and then for the second hour after 30 minutes. So, always remember that. Another very interesting topic in the fourth stage of labor is lochia. So, where does this lochia come from? The decidua is the thick layer of modified mucous membrane which lines the uterus during pregnancy and is shed within the first days after childbirth. Always remember that when the uterine lining, the uterus becomes pregnant, the lining is already called decidua. So that lining, uterine lining, is more vascular in nature, meaning there are more blood vessels that are found there in the decidua so that the placenta can properly implant itself in the uterus. So when the woman becomes pregnant, hormones like progesterone will cause the uterine lining to thicken and become more vascular. You have to remember that the pregnant hormone progesterone, they cause the uterus to be more thick and to be more vascular. Okay, so they develop more blood vessels to support the placenta and the growing uterus. Always remember that the decidua is composed of different layers. And what are these layers? Number one is what we call decidua basalis. This is where the implantation takes place and the basal plate is formed. And this layer of the pregnant uterus is where the chorionic villi is attached. These chorionic villi are hair-like structures that connects itself to the decidua or the lining of the uterus. And your chorionic villi will become the placenta. We also have what we call decidua capsularis, which is a layer that develops surrounding the chorion. In other words, this is a layer of the pregnant uterus that envelops or encases the fetus during pregnancy. So we have the picture of the decidua basalis and decidua capsularis. So number 2 here is the decidua capsularis. So this envelops the growing fetus. Itong part pong ito is what we call the decidua capsularis. Coming from the word capsule, it encapsulates the growing fetus. However, number 3 here is decidua basalis. So this is part of the decidua where the chorionic villi gets implanted. So this part is the decidua basalis, and these finger-like structures connected to it are what we call the chorionic villi. And as time goes by, your chorionic villi will become the placenta. We also have another layer of the decidua, and this is called the decidua parietalis. It is the layer of the decidua that is directly on the opposite of the decidua vera or decidua basalis. And this layer of the pregnant uterus is neither part of the decidua basalis or the decidua capsularis. We also have number 4, the uterine cavity, and this refers to the space inside the uterus. This empty space houses the fetus as it grows and develops. So we look at our drawing of the decidua, and as you can see, the decidua parietalis is number 1. Dito po yun. Alright? And as defined a while ago, this is directly on the opposite of the decidua vera or the decidua basalis. So, kung saan natin makikita yung decidua basalis, on the opposite niya is the decidua vera. Decidua parietalis, dito pong part. Alright? Dito, this one. And number 4 is your uterine cavity, which refers now to the space inside the womb of the mother, where the fetus will grow. Now, why do we have to study the parts of the decidua? Because your decidua after delivery will become your lochia, and they will also be shed off by the mother. So as mentioned earlier, the decidua will be shed off, or there will be sloughing off of the decidua after the delivery of the child. The uterus will begin to contract and shrink to its usual size, and the uterine lining will also shed. Bakit kailangang tanggalin na ng katawan yung decidua? Because the mother is no longer pregnant, therefore the uterus does not need to be very vascular. Hindi na niya kailangan ng maraming mga blood vessels doon because it is not anymore feeding a growing fetus. Therefore, the decidua should shed off because it is no longer needed and the mother is no longer pregnant. So what happens? The decidua becomes necrotic. It becomes a dead tissue because the mother is no longer pregnant and the body no longer needs it. And once the decidua becomes necrotic or a dead tissue, it is cast off as a uterine discharge. So since patay na siya, dead tissue na, the body will cast it off and it will become a uterine discharge, which is similar to your menstrual flow. Para din siyang regla ang itsura. So in simpler terms, the decidua is excreted outside of the mother's uterus, and when it goes out of the uterus, it is already termed as lochia. Now, lochia, as defined by Adele Pelletieri, are normal discharges from the uterus after childbirth. These are normal discharges that are composed of different components like your blood, decidual fragments, which may appear as blood clots, white blood cells, mucus, and even some bacteria. These are the components of your lochia. Sometimes, mothers will describe the pain to be period-like cramping. Sir, kasla agpapasikil deto, cramps deto uterus. Or they appear as mini contractions. These contractions intensify during breastfeeding because, like I said, there is a release of oxytocin, which stimulates the uterus to contract. The lochia will approximately take 6 weeks until they disappear, because on the first 6 weeks of life, that is the time wherein the lochia sheds off and the uterus is cleansed and healed. In that 6 weeks of time, the woman is also expected to have vaginal discharges that vary in color. So yung lochia po, hindi lang po iisa ang itsura niyan. Nag-iiba-iba din depending on the time or the period of time during the postpartum. The bleeding gradually lessens over time, and the lochia changes in color as time passes by and as the mother's uterus returns to its normal size and position. Now we have the different types of lochia. Number 1 is Lochia Rubra. This is the first stage of bleeding after birth. And this bleeding or lochial discharge is typically seen on the first 3 days after delivery. Coming from the word rubra, the Lochia Rubra is bright red in color, and it is composed of blood, sometimes small bits of membranes, cervical discharges, and even meconium or the baby's first fecal discharge. So the first type of lochia is Lochia Rubra, and it appears on the first 3 days of life, and the color is bright red. The next type of lochia is what we call Lochia serosa. This is the second stage of bleeding that occurs during the 4th to the 10th day after delivery. Lochia serosa is usually pinky brown in color and is more watery in consistency. So as compared to your Lochia Rubra, Lochia serosa is now pink in color and more watery in nature. The discharges become pink in color because of the amount of blood that is shedding off in the decidua already decreases. So dahil konti na lang po yung dugo na lumalabas coming from the uterus, kaya nagiging pink na lang po yung lumalabas na lochial discharge. The white blood cells also have a particular effect on the lochial discharges, particularly the leukocytes. They begin to invade the uterine wall to facilitate the healing of the uterus. Therefore, makakakita na tayo ng color pink na discharges kasi nga the leukocytes will help the uterus heal. Therefore, mas konti na lang po yung bleeding, and kung konti na lang yung bleeding, you can expect that the lochial discharges will be color pink. The last type of lochia is what we call Lochia alba, and this is the final stage of your lochial discharges, and it is usually observed from the 10th day up to the 14th day of postpartum, and sometimes it can even last up until 6 weeks. The uterine discharges become much less heavy, and they have a yellowish-white color. It contains fewer red blood cells, I should say, and is mainly made up of white blood cells, tissues, sometimes cholesterol, fats, and even mucus. So what's very important in your Lochia alba is that it no longer contains red blood cells. Therefore, the color of the lochial discharge is yellowish and white in color. And when your Lochia alba appears, it is already a sign that the uterus is already starting to fully heal. We have a review of the different lochial discharges according to type, postpartal day, color, and composition. As discussed a while ago, when we say Lochia Rubra, it happens in the first 3 days after delivery, and it is colored red. It is composed of blood, fragments of decidua, mucus, and even meconium. The second type is Lochia serosa, and it appears on the 4th day up to the 10th day of postpartum period. It is pinkish brown in color because there is lesser blood. However, it is still composed of blood, mucus, and invading leukocytes. The third type of lochia is what we call Lochia alba, and it occurs on the 10th day up to the 14th day of postpartum, but some patients also experience this up to the 6th week of postpartum period. It is usually yellowish-white in color and is largely made up of mucus and leukocytes. Now, what is our midwifery responsibility when we are evaluating for the lochia? Number one is you should always evaluate the amount of lochial discharges coming from the vagina of the mother. Always remember that lochial discharges vary from woman to woman. Ibig sabihin, kung gaano kadami yung lochial discharge ni patient A, ay hindi sila magkapareho ng discharges ni patient B. Remember also that women who breastfeed normally have less lochia. Mas kokonti lang po yung lumalabas na lochia or lochial discharges from breastfeeding women because these breastfeeding women generally have more oxytocin because the nipples are stimulated. At kung maraming oxytocin, the uterus will contract faster and stronger, therefore mas madaling mag-close yung mga open na blood vessels that are found in the uterus. Remember also that the amount of lochial discharges increases during exertion. So you have to advise the mother to rest and avoid too much manual labor. Totoo po yung sinabi nila na hindi po pwedeng magbuhat ng mga mabibigat pagkatapos mga anak. That's true because when a mother carries heavy objects during her postpartum period, there's a possibility na mag-bleeding yon because, like I said, exertion increases lochial discharges. Aside from that, always remember that ambulation and walking also increases amount of lochial discharges. So it's a good idea to make the mother rest for a while, lie in bed for the first 3 days postpartum so that we can prevent postpartum bleeding. Always remember that a full saturated perineal pad in less than an hour is considered already an abnormal flow. So pag yung nanay na puno niya or na-soiled niya yung isang perineal pad within the first hour, that is already an abnormality and should be reported to the doctor immediately. Another midwifery responsibility that we have in evaluating the lochia is checking the consistency. Remember that the normal lochia does not have large clots. Wala pong nakikitang clot doon sa lochia. Note that in case there is a presence of large clots in your patient, you have to report it immediately to the resident on duty. Bakit po reportable ang mga large clots? Because they may indicate retained placental fragments. Baka merong Another midwifery responsibility that we have in evaluating the lochia is checking the lochia for its consistency. Remember that the lochia does not have large clots. And in the event na makakita ka ng large clots sa inyong pasyente, it is reportable to the resident on duty. Why do we report the presence of large clots in the lochia? Number one, this may indicate retained placental fragments. Baka may mga naiwang placenta sa loob ng uterus ng nanay. It may also denote poor uterine contraction. Large clots are present in relaxed uterus. So you have to also double check it if the uterus is relaxed or not. And also, large clots may also be indicative of open uterine sinuses. Baka may mga blood vessels pa doon sa uterus na hindi pa nagko-close kaya merong large clots na lumalabas. Another midwifery responsibility when it comes to checking the lochia is observing the pattern of the lochial discharge. It is red on the first 3 days, pink on the 4th up to the 10th day, and yellowish on the 10th to the 14th day up to the 6th week. Remember that this pattern or sequence of appearance should not be reversed. If there is a reappearance of a red flow, this may indicate retained placental fragment. Kunwari, nandun na siya sa 4th day or 7th day na kunwari siya, you expect that the mother will already have pink lochial discharge. Pero nakakita ka ulit ng red flow from the vagina of the mother. That may indicate, again, retained placental fragment. It may also tell you that the uterus is not contracting well enough, and it is a sign of a new bleeding. So like I said, you have to observe the patterns of the lochia and make sure that they follow the correct sequence of appearance. Red on the first 3 days, pink on the 4th to the 10th day, and yellowish white from the 10th to the 14th day. Another responsibility that we have is assessing the odor of the lochia. Remember that lochia has the same odor as your menstrual blood. Magkapareho po ng amoy, kung inaamoy nyo man, ang mens nyo at ang amoy ng lochia. It should not have an offensive or fishy smell. Hindi po siya dapat mabaho, mapanghi. Why? Because an odorous lochia may mean uterine infection. Always remember na pag iba na yung amoy, there's a possibility for infection. And this is also reportable to the resident on duty because the patient might need antibiotic therapy if you assess the presence of the odorous lochia. Another midwifery responsibility that we have is watching out for the absence of the lochia. Always remember that all patients will have lochial discharges during the postpartum period, and it is considered abnormal if lochial discharge is not noted on the first 3 weeks of postpartum. Why? Because it may be a sign of infection. Maaaring ito ay scanty or little in nature, especially for CS patients, but lochia should never be absent. Note that an absent lochia is caused by infection, and so this should be reported to the doctor immediately because the patient should be given antibiotics. If the lochia is absent, you also have to look for odorous vaginal discharges. Kasi most often, kung walang lochiang lumalabas, merong ibang discharges na lumalabas but it is already odorous in nature. So report immediately so that the patient can be given antibiotics as per doctor's prescription. We also talk about the cervix and its involution. Remember that after childbirth, the cervix is soft and malleable, and it contracts immediately after delivery to promote involution. Remember that the uterus is not the only organ to involute or retain to its normal position, and the cervix will also experience contraction. On the first week of postpartum, the external os of the cervix has narrowed to a size of a pencil opening. So liliit po yung opening ng cervix. Di ba po nga, when there is childbirth, the cervix is expected to increase in diameter for 10 centimeters. But on the first week, that opening will become narrow and it will be the size of a pencil opening. The cervix closes to about 1 centimeter after the first week of postpartum, but it may take several months to attain the pre-pregnant state. Mahihirapan din siyang bumalik sa kanyang pre-pregnant state and it may take several months for it to return to its normal size. Now, the postpartum cervix often has a transverse or smiling appearance as opposed to the nulliparous pinpoint appearance. So kung yung babae po ay hindi pa siya nanganganak, ganito po yung itsura ng kanyang cervix. It is circular in appearance. But after the delivery and during postpartum period, since the cervix has already opened to 10 centimeters, pag bumalik siya, it will already have a smiling appearance. So those are the things that you have to consider when assessing the cervix of the mother. It will not return to its normal size. It will have a smiling appearance rather than the appearance of the nulliparous cervix. We also talk about the vagina. After delivery, the vagina is soft and with a few rugae. When you say rugae, these are skin folds that allow the stretching of the vaginal canal. The vagina will also have a diameter that is considerably greater than normal. So you can expect that the vaginal opening is bigger or wider after delivery. Bakit? Kasi po, kapapanganak pa lamang ng bata, naturalmente, the vagina is still open, wide open. The vagina will also contract to allow organ involution. So hindi lang po uterus at cervix ang nagko-contract, even the vagina will also experience contractions for it to return to its normal size. Remember that breastfeeding women may continue to have thin-walled or fragile vaginal cells that may cause slight bleeding up until the 6th week of postpartum. Bakit? Because of the presence of oxytocin. Your oxytocin will also create a thin-walled or fragile vaginal cells. Therefore, yung vagina is prone to bleeding on the first 6 weeks of postpartum. Also remember that during breastfeeding, along with oxytocin, progesterone is also released, which also makes the vaginal wall sensitive and tender. The vaginal outlet remains more distended than before. Bakit? Kasi meron ngang lumabas na bata, therefore the vaginal outlet is bigger in diameter. The labia majora and minora will also remain softened at birth. However, they will no longer return to their pre-pregnant state. Hindi na po babalik sa pagiging itsurang virgin yung inyong vagina pagkatapos nyong manganak. So this is how a vagina looks like after giving birth. So as you can see, there is a wider diameter on the vagina that has already experienced birthing as compared to the vagina that has not yet experienced delivering a child. We also talk about the hymen, which is permanently torn. It will heal, but it will already appear to have small tags, separate tissues. So, like I said, the hymen, if it is already torn, especially during childbirth, will no longer return to its pre-pregnant state. The perineum, because of the presence of a great amount of pressure during childbirth, may also develop edema and generalized tenderness. So, it's normal for a patient to say, masakit yung kanilang perineum because it has experienced great amount of pressure by the passing head of the child. The mother may also note for ecchymosis in the perineal area. When we talk about ecchymosis, these are bluish purple-black discolorations of the skin which are resulting from bleeding underneath. And they are typically also called bruising, or in Ilocano, on Tagalog, pasa. The perineum may have pasa or bluish black discoloration. And what do we do when we see those kinds of things? We can apply ice pack to stop the capillaries in that particular muscle to bleed. Now, what are our midwifery responsibilities to improve the involution of the cervix, the vagina, and the perineum? Number one is you have to give ice packs to the postpartum mother. In case you see an edema or bruising on the vagina or the perineum after delivery, you may want to offer the mother ice packs and place it on the affected area. Number one, to relieve pain. Number two, you also want to minimize swelling by giving ice packs. And number three, ice packs also have numbing effect, or it will relieve the tenderness that is felt by the mother in the edematous vagina or perineum. Another thing that you can do is you advise the mother to do Kegels exercises. Paano ba ginagawa yung Kegels? At ano ba yung Kegels? Kegels exercises can help heal the perineal tissues, which are stretched out during the vaginal birth. It also increases vaginal muscle tonicity. Paano ginagawa yon? You make sure that the patient's bladder is empty, and then ask the patient to sit down or lie down, depending on her comfortable position. The next thing that you're going to do is help her to tighten her pelvic floor muscles. Advise her to mimic the motion of the pelvic muscles when she needs to hold her pee or poo. So sabihin mo, mother, imaginein mo na kayo po ay ihing-ihi na pero hindi kayo makaihi dahil may tao sa CR. What is that motion? You are contracting your pelvic floor. That is how Kegels exercises is done. So pag ginawa niya yung position na yon, ask her to hold that motion tight and count for 3 to 5 seconds. After 3 to 5 seconds, you can ask her to relax the pelvic floor muscles and then count 3 to 5 seconds of rest. After that, repeat the motion 10 times, 3 times a day, especially during the morning, afternoon, and evening. And that will improve the involution of the cervix, the vagina, and the perineum. Now, let's also try to do the Kegels exercises. Imagine yourself in front of the CR and you need to pee or poo, pero may tao sa CR. And then, apply pressure on your pelvic muscles by helping it contract. Hold it for 3 to 5 seconds. 1, 2, 3, 4, 5. Relax for 5 seconds and repeat. That is your Kegels exercises. So as you can see, your Kegels exercises will also improve the involution of the vagina, pelvic floor muscles, also the rectum and the uterus. So help the mother do this by telling her what to do. Another topic that we have is the resumption of menstruation, or kailan babalik yung mens ng nanay na katatapos lang manganak. Resumption of menses or menstruation after delivery is highly variable from one patient to another. There will be some patients who say after 3 months, bumalik yung kanilang regla. May mga ibang patients na magsasabing after 7 months or after 1 year, bumalik yung kanilang regla. That's typically normal because the resumption of menstruation is highly variable from one patient to another. However, you have to remember that breastfeeding has an effect on the resumption of menstruation. Bakit? For the mothers who are not breastfeeding, their menses may return approximately from 55 to 60 days after delivery. So within the first 3 months pa lang, magre-regla na ulit yung mother, especially if she is not breastfeeding. However, for breastfeeding mothers, they may delay the return of their menstruation by several months, especially if the child is getting no other supplementary source of food but the breastfeed alone. Anong ibig sabihin nito? That the mother will not experience menstruation soon if she is exclusively breastfeeding. And does this mean na hindi ulit mabubuntis si nanay kaagad-agad? Yes. That is the reason why breastfeeding is also a form of family planning. And this is what you call lactational amenorrhea method. Now, what is your responsibility when it comes to resumption of the menstruation? You have to give adequate birth control and family planning advice to the mother and the father, especially during the early postpartum period. Bakit? Because especially for patients who are not breastfeeding, within the first 3 months, babalik na naman yung mens niya, and when they have contact with the husband, maaaring mabuntis ulit yung nanay. And the uterus is still recovering from the previous pregnancy. So mabuti that you give adequate birth control and family planning advice during the early phase of postpartum para hindi agad mabuntis si mother. This is not just for the health of the mother but also for the health of their family and their unborn child, just in case mabuntis ulit yung nanay. And that concludes our 6th pre-recorded video lecture for the subject Clinical Practicum 101B. I hope you enjoyed the class as much as I did. However, I will have to check how much you've learned in our session together. So, review your notes because I will be uploading another quiz in your Edmodo class. As always, keep safe, be healthy, stay at home, and try to stay alive. Maraming salamat po.